Alrighty, here we are in chapter 12. So today we are going to talk about dietary supplements and over-the-counter drugs. I mentioned a little bit about this before. Dietary supplements and over-the-counter drugs are such a huge, wide array of things. Some people who make these things have very good intentions and are actually helping people. Others who make these things are just trying to make money and are making crap. So let's get started. All right. So here's the thing. Drugs and food. Drugs and food are similar in some respects, right? They both contain chemicals that interact with the body's physiology. Now, dietary supplements, for most of us, we think about them similar to drugs, like similar to aspirin, St. John's wort, aspirin, whatever, St. John's wort, different things. However, supplements, dietary supplements are classified as food products, okay? So therefore they're regulated dramatically different, okay? So all these different dietary supplements, vitamins, those are regulated in the same way that Fruit Loops are regulated, not in the same way that an antidepressant is regulated, not the same way that an over-the-counter medication is regulated. Completely different. Now, the Food, Drug, and Cosmetic Act, that you guys are somewhat familiar with, defines a drug as a product that is intended for use in the diagnosis, the cure, the mitigation, the treatment, or the prevention of a disease, okay? And if you remember, according to that act, at this point, drugs have to be shown that they're safe. They won't, harm people when used as directed, and that they're effective for their intended use. Okay, that is drugs. Now, supplements, according to the act, food products, and remember, supplements are food products, as far as the law goes, food products have to be safe, okay? They have to make sure that they're probably not killing people, although they don't actually have to go through the same procedures as drugs do, but if they start harming people, they can be taken off the shelves, that is supplements or food. They also have to be pure, so you can't have other things in them that you don't know about. So you can't put cocaine in it and not tell anybody. All right. However, according to the act, supplements, which are food products, are not required to show that they are effective or that they provide any benefit. Okay? If you are someone who takes a lot of supplements, you may be a very educated supplement taker and you've done all your research and you know what the things are and you know what research shows works or doesn't work. However, if you are not a very educated supplement taker, you may go into the store and say, oh, I want something that will help my joints, or I want something that will help me lose weight, and you pick something up because the bottle says it will benefit your overall health. It will benefit joint happiness. It will help you lose weight. That doesn't have to be true. It doesn't have to show that it is actually effective or provides any benefit. You could just be taking pills that are caffeine or that are, whatever it says on the bottle that it is, but does not have to provide any benefit. It does not have to be effective to be sold. I find this interesting, clearly. All right. Dietary Supplement Health and Education Act of 1994. This was passed in part due to pressure on Congress from the supplement industry. And this was they really wanted to limit FDA regulation. And so Congress passed a bill saying, yeah, sure, FDA can't really regulate very much on the dietary supplements. Now, the Dietary Supplement Health and Education Act made several important changes, redefining which substances could be dietary supplements, redefining presumed safety, and vague health claims without proof were allowed. Again, I find this wild that this is what Congress has passed. To say, oh yeah, it's okay for you to make health claims without proof. That's cool. It's okay to have a little bit of less, presumed safety. It's okay, it's interesting to me. Okay. Again, these vague claims are those things that you see on bottles that say, improves joint health, improves overall well-being, boosts mood, or things like that. They're very vague, they're general, they could really mean anything. Now, the DSHEA expanded the definition of supplements, and now it included vitamins and minerals, herbs, and amino acids. Again, when you pick your vitamins that you take, please do research on the companies that you purchase from. Some are wonderful. Some are just trying to make a buck off of you. Now, interestingly, unlike medications, drugs, things that are considered drugs, each pill has to have the exact same amount of whatever in it. Another thing that's not regulated with supplements is exactly what's in every single pill. So within a bottle that you have, each pill hopefully generally has about the same amount of stuff in it, but doesn't have to. Again, critical thinking skills. All right. FDA can declare a dietary supplement to be unsafe. So again, if we think about how drugs are regulated, drug companies have to prove safety and effectiveness before going to market. With supplements go to market, and if enough risk has been reported or injury has been reported, then the FDA can go in and make a case to declare it unsafe, and then it's taken off the shelves. So the proof of burden is switched here. I hope that makes sense. Now, ingredients already on the market at the time of the act, they just decided that those are safe enough to be sold unless the FDA can demonstrate a risk. Recent rules have emphasized safety, so there are good manufacturing practice rules. There are adverse events reporting processes, but the rules for supplements are still significantly more lenient than those for drugs. Supplement labeling. So dietary supplements cannot claim to be a treatment for a disorder, but they can say beneficial effects on a structure or function of the body, on well-being in general. They don't have to prove these claims. They can just believe them in their heads. They only have to provide evidence that the claims are not false or misleading. So it can't be like, I'm going to put, poison in a bottle and then say it's good for you, because that would be the opposite. So you can't do something that's completely false. But you can say, improves feelings about life. Maybe. I don't know. They say lots of things. You should go look at some of these phrases that are used on bottles. They're quite interesting. Labels must carry a disclaimer. So you will notice now on supplement labels, there is a statement that says that it has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. I think supplement companies know that most people don't really read that or don't really understand what that means. Now you understand. Please be smart. So pros and cons. Okay, pros would be, because of this process, there are so many more supplements on the market because they don't have to go through this very difficult process that drugs do. So consumers have more options. However, there's much less research available about the safety and effectiveness. Supplements remain on the market until FDA presents a clear evidence of risk, which means people have probably died. Case in point, ephedra. All right, ephedra is a stimulant for weight loss, and I've mentioned this before. Ephedra was on the market, it went away, it is back in smaller doses now. But in 1994, there was first evidence of safety concerns published by the FDA. And so what ephedra is, if you can't remember, ephedra is a central nervous system stimulant. It increases your heart rate, it makes you a little sweaty, it increases, your breathing, all those things, stimulating the central nervous system. And it does it pretty intensely. So you were having a lot of people end up in the emergency room after using ephedra, having heart palpitations, heart issues. It's pretty intense, okay? This was sold often in drinks at gyms, places like that. 1994. It took 10 more years for the FDA to compile evidence to get it off the market. And it got it off the market completely for a little while, and then, the ephedra people came back, and it is now allowed in smaller doses. It was, in pretty, higher doses when it was out there originally. But it was causing a lot of problems for people heart-wise. So there's that. 94, I'm trying to think. Even so 2004 would be when it was then taken off the market. I remember being in graduate school and the gym near our house still had some in the back that they hid. But that might have still been like 2005. I'm not sure. I've lost track of time. Okay. 2010. Dietary Supplement Act introduced by Senator John McCain. Good intentions here. All manufacturers would have to register with the FDA. Manufacturers would have to provide a complete list of ingredients, which means that they don't actually have to do this. This was just presented in the act. The FDA could recall any ingredient they found to be unsafe. These seem to me like really reasonable things. However, the dietary supplement industry is huge and makes a lot of money and has fabulous lawyers and lobbyists. The dietary supplement industry mounted a huge campaign against the regulation, and McCain said fine and withdrew the bill. Okay, this is not a pro or against McCain kind of thing. This is just talking about how this goes down. Could have been a good bill, but shut down. All right. There are a lot of different dietary supplements, vitamins, things like that. We also have psychoactive dietary supplements. So St. John's wort is a pretty popular one that's used for, or people use it for depression and anxiety. Okay. It was once at some point thought to prevent possession by demons, so that's a pro. There is some evidence supporting its use for depression. I'm not saying that it doesn't work. However, it's a supplement, and therefore there are different companies that put it out. You may be getting different things with different companies. This is a psychoactive dietary supplement. Some people want to take this because they say, well, this is natural versus this other thing. That's a questionable statement. It will interact with other prescription drugs. You do need to tell your prescribing physicians if you're taking this, because they may be prescribing other things that they need to keep this in mind. Like I said, there is some evidence supporting its use. There's some evidence that would say it does nothing. Okay. Here's another, another one is SAMe, and this is a naturally occurring substance found in the body, the active form of amino acid methionine. It again is a possible antidepressant. Several studies indicate that it's effective. But there's also studies that haven't been really well controlled. They haven't, gone through the same processes of drugs that are FDA regulated. Okay. Another one that people just seem to like is ginkgo biloba. And this has a long history of medicinal use in China. There's active ingredients are generally unclear, though. It does seem to reduce blood clotting. It may improve circulation. Now, it's going to be risky when used with aspirin or other drugs that also reduce clotting, so you don't want to combine these things. But again, these are supplements, so you've got to figure this out on your own. Research does suggest slight improvements in memory. So people do take ginkgo biloba. They've taken it for billions of years. In no way am I going to say ginkgo biloba is a bad thing. I will again say, please be aware of who you purchase these things from. Is this a trustworthy company? Is this a company that has good intentions? Or a company that's just trying to screw you? What do I want to do? I was thinking I had something else I wanted to say. No? Okay. All right. Let's move on. Weight control products. So this is the biggest dietary supplement section in the market. Go into, if you've never looked, go into a drugstore and look at the area where there are weight control products. Oh my gosh, it's crazy. There's so many different things. And no evidence of effectiveness is required. And there's no wonderful studies to say that any of these products actually freaking work long term. Most of these things are like caffeine, or they are things that are like caffeine. Go get a freaking latte, guys. Less likely to kill you. You don't know what's in this junk. People hoping to lose weight are the biggest dietary supplement market. So many different products. No evidence of effectiveness is required. An example, Herbalife. Herbalife reported $3.5 billion in worldwide sales in 2011. Not a single academic, not a single legit academic or person who actually researches weight loss has ever recommended Herbalife. Okay? If it actually worked, we would be using it. We wouldn't be still searching for other ideas. We wouldn't still be, doing weight loss surgeries. Come on. Now, does it work for some people? It works for motivated people. Before the FDA banned ephedra, many of the original Herbalife products contained ephedra. Now they just contain these high doses of caffeine. Again, go have some coffee. It doesn't have all the other junk that's in Herbalife. Now, Herbalife is a tricky thing. They get you set up, and you're technically allowed to cancel, but it's actually very, very difficult to cancel. There's a lot of lawsuits with companies like this. They make an amazing amount of money off of people who have forgotten to cancel, who aren't actually using it anymore, people who have probably had adverse reactions. Not great. Herbalife along with any of the others that are very similar to this, okay? These are not FDA regulated products. These are not FDA approved products. Now, before we go to over-the-counter drugs, so this is dietary supplements, and let me just say this. If things work for you, wonderful. I don't want to take that away from anybody. I'm a huge fan of if it works, great, go with it. I'm also, want to be really clear. I'm not against dietary supplements. I'm not against vitamins. Please be a well-informed consumer of the products that you purchase. Be smart. Don't let these stupid, horrible, CEOs of sketchy supplement companies come in and take advantage of people like, friends or relatives that you have that don't really know about this stuff. Okay, let's talk over-the-counter drugs. So over-the-counter drugs, these are self-prescribed treatments for self-diagnosed illnesses. Americans self-treat 4 times as many health problems as doctors treat. And we do it with over-the-counter drugs. And I think that this makes a lot of sense, right? Like, I'm not going to the doctor because I have a headache. I know how to fix a headache. It makes sense, right? You have a cold, you have certain things. We kind of know what to do. You have something that's, itchy bug bite, you can go get something. Americans spend over $18 billion per year on over-the-counter drugs. Now, FDA regulation of over-the-counter products. In 1962, you had the Kiefer-Harris Amendment, if you remember. It required that all drugs be evaluated for safety and efficacy. Wonderful. Now, the FDA was charged with reviewing all the over-the-counter drugs. Okay, the over-the-counter product marketers or creators, manufacturers, were not asked to then come back and test everything and show the FDA. The FDA was required to go through everything that was on the market. Oh my gosh, there were about 300,000 products at the time. Way more now. So almost an impossible task. Interestingly, within all of these products, 300,000 products, there were actually fewer than 1,000 total active ingredients. We see the same thing now. There are very few active ingredients. They're just put out there in different ways, in different forms, in different time release, in different capsules. So they went ahead and they reviewed the active ingredients rather than reviewing each specific product. So that doesn't mean that they reviewed all the interactions, but they reviewed the ingredients and decided that they were safe. Okay. Now, the over-the-counter regulations, you have these 3 things, 3 standards here. Generally recognized as safe, generally recognized as effective, and generally recognized as honestly labeled. So, let's go safe, generally recognized as safe. Given currently available information, the ingredient is considered safe. What is safe? Safe is a, quote, low incidence of adverse reactions. This is subjective. And no drug is entirely safe, right? But we want to show whatever they consider a low incidence of adverse reactions. Okay. Then we have generally recognized as effective. A reasonable expectation that the pharmacological effect of the drug will provide clinically significant relief. So clinically significant relief means that of people, they report a change. They report relief. They say, I have a headache, I take this medication, I did not notice anything. I take this medication, I had a headache, I take this medication, and I have relief. So clinical significance would be self-report. Okay. So there's that. Generally recognized as honestly labeled. What they want is they want the list of ingredients. They want, you know, percentages of how much somebody's supposed to have that day, things like that, in instructions, okay? So now before 1997, all different companies kind of created their own labels and how they wanted to do it. However, uniform labeling standards were adopted in 1997 to reduce consumer confusion. So now you should be able to see when you grab several different products, if you turn them over, the layout, the heading, the topics are consistent. They should look about the same so that you can compare. Language has been made clearer and more concise, less medical jargon. Less medical terminology, so clearer, more concise. Consistent labels make it so much easier for us lay people to compare products. There are an overwhelming number of products out there. This is good. Okay. 1939, we have the Food, Drug, and Cosmetic Act. Again, you're familiar with this. Established a classification of drugs that can be sold only by prescription. Possible differences between over-the-counter and prescription drugs are going to be dosage. So an over-the-counter version of a drug may come in smaller doses. Chemicals, a prescription drug may contain a chemical that's not allowed for over-the-counter sale due to potential toxicity. Okay. Now, with the over-the-counter drug review process, the FDA reviews products and may switch drugs to over-the-counter status. Now, examples of drugs that switch to over-the-counter status. Ibuprofen is Advil, which is it's an analgesic. We have things like Prevacid, things like Allegra. Okay, there's some things that change. Hold on, I want to look at something real quick. Okay, good. Oops. From current slide. Okay, great. Stimulants. The only legal over-the-counter ingredient is caffeine. So if you see anything that is working as a stimulant, it's caffeine. Combinations of caffeine and other stimulants are not allowed. All right, sedatives and sleep aids. Now, I always find this interesting. Early over-the-counter sedatives and sleep aids were a combination of an acetylcholine receptor blocker and an antihistamine. These were found to be unsafe, so things have changed. Now, there are several different sleep aids out there. There are different kinds of things. This is over-the-counter, right? None of the prescription stuff we're talking about here, just over-the-counter. But currently, the only over-the-counter drug that's FDA approved is diphenhydramine, which is an antihistamine. So all of these different products that talk about being sleep aids are really just antihistamines that make us sleepy. Now, diphenhydramine, FYI, in case you want to look it up, not suggesting to do it, but is sometimes used as a recreational drug. In case you have like teenagers and you find a bunch of like this kind of stuff in their room, maybe take it. Okay. And that is take it away, not take it as meaning use it excessively. All right. Psychoactive over-the-counter weight control products. So we've had, again, people like to lose weight and they want to do it by a pill and not by exercising and changing their eating and all of that. So big markets, right? In the 1970s, we had something called PPA. PPA or fen-phen, some people, you may have heard those words, were these legal over-the-counter products. People loved them and they worked. They also started really harming people. A lot of emergency room visits due to these types of products, PPA specifically. In 2000, FDA requested all companies stop marketing products containing this. There were concerns over safety and effectiveness. They were actually, like, some people were dying because of extreme central nervous system stimulation, as well as, just heart issues in general. So they don't allow that anymore. But if you talk to people, a lot of people had been prescribed fen-phen or PPA at some point. Okay. Now, there is only one FDA-approved weight control product out there. So when you go and you look at all the supplements that are for weight control, and most of them are BS, and they're mostly just caffeine or caffeine-like things, do know that you have one FDA-approved weight control product out there. It's called Orlistat, or Ally. Some people say Ally. Let me tell you about this. Does it work? Kinda. However, you may not want to take it. So what it does is it changes the way that you break down food and changes what you absorb versus do not absorb. So it takes the fats and it makes it so that you're not absorbing some of the fats that you're eating. And therefore you excrete those fats. That's a lovely way to say it. Let me say it in a different way. You will poop out these fats, and people will report oily, fatty stools. So there's a lovely picture for you, right? Fatty, oily stools, as well as during the day leakage. Again, I'm going to let you use your imagination. So leakage leads to being smelly and kind of yucky. You don't want oily, fatty things leaking from you during the day. However, some people don't have so much a problem with that, and this is a product that works well for them. It's FDA safe. It's FDA regulated, FDA approved, so it's an option. Okay, let's talk about people and pain. This is another huge market. People do not like to be in pain, understandably, right? Pain is a subjective experience, and people experience it differently. People have different thresholds for pain, on and on and on. Okay, now I want you to know the different classes of these drugs. I want you to know the 3 different over-the-counter analgesics that we talk about here. 2 major classes. We have our anesthetics. Anesthetics reduce all types of sensation or block consciousness completely. Okay? Now our analgesics are what we more so use. Our analgesics reduce pain selectively without causing a loss of other sensations. You may think, how does my Tylenol know to go down to my toe to stop the pain? It's brilliant. That's how. It reduces pain selectively. It reduces the perception of pain selectively without causing a loss of other sensations. So we have our 3 major over-the-counter analgesics: aspirin, acetaminophen, and ibuprofen. All right. Now, the experience of pain varies with personality, gender, time of day, if you're in a bad mood, if you're in a good mood, right? Like you wake up in the morning, you stub your toe, you're running late, you're in a bad mood, you scream, you yell, you hate it, it hurts so much, it's throbbing, you have to scream, maybe cuss. at the thing that you stubbed your toe on because it clearly did it intentionally. Or you're out with your friends, you're having a totally good time, things are going really well, you're in a good mood, you stub your toe and you're like, ah, that hurts, darn, I wish I hadn't done that anyway. So let me tell you about, right? Same situation, different experience of pain. About 35% of patients obtain relief from placebo. If you've ever had a headache and you realize you have no access to headache medication, your headache continues and is horrible. If you have a headache and you realize that you do have access, all of a sudden you feel a little bit better. And then once you take that pill, it goes in your mouth, down your throat, you feel at least some relief. Often, depending. But often there is some relief before the medication actually starts working. And some people obtain pain relief from taking just a sugar pill when they think it is aspirin, acetaminophen, or ibuprofen. Okay, so we'll talk about these three. Aspirin. Aspirin is been used for a long time in use of teas, extracts of willow, popular bark for pain relief. So that is other things that were used in the past, right? People don't like pain. 19th century, the active ingredient, silicic acid. I always say it wrong. I feel anxious sometimes before I say it. Identified, synthesized, mass-produced. 1898. This is synthesized by the Bayer Company. You may still recognize that name. In 1915, aspirin was sold over the counter in tablet form. Changed everybody's lives, right? So, aspirin's therapeutic use. I do want you to know these three words: analgesic, antipyretic, and anti-inflammatory. Okay, so aspirin is all three. Aspirin is an analgesic, which means it blocks mild to moderate somatic pain. It's effective for things like headache and musculoskeletal pain. So that's what an analgesic is. An analgesic blocks pain. Antipyretic. An antipyretic reduces fever. It causes vasodilation of the peripheral blood vessels and increased perspiration, but it reduces fever. That's the antipyretic effect. If you think about, just to help you here, pyretic, pyro, fire, fever, reduces fever. Okay. Anti-inflammatory. I mean, you should kind of know this one. Things that are inflamed, swelling. Anti-inflammatories reduce swelling, they reduce inflammation, they reduce soreness. It's used often for an arthritis treatment. Aspirin's used for a lot of different things and also not recommended for other reasons. Okay, now here's one. It inhibits blood platelet aggregation. So what that means is that it prevents blood clots. Blood clots are not good, and therefore it's often, thought, well, baby aspirin, as people will call it, may help with heart issues. Now, if it's preventing blood clotting, then it can cause bleeding for surgical patients. So when somebody's just had surgery, or if somebody is pregnant, or if somebody, there's a lot of reasons why this could be a problem. It's recommended that you do not take aspirin. Now, it may prevent heart attacks and strokes by preventing clots in high-risk patients. It does induce gastrointestinal bleeding if taken too much, too often. So be careful about that. Also, there's something called Reye's syndrome. Reye's syndrome is rare, but it's a pretty problematic issue. Symptoms include disorientation, personality change, being lethargic, coma, and death. Now, This is why they actually recommend that you don't use aspirin for young people, especially young people who have the flu. So if you have a child who has the flu, do not use aspirin. Although it's still unlikely that there will be a problem, if there's a problem, it can be a big problem. Almost all cases occurred in people under age 20 who had viral illnesses like the flu or chickenpox. Fortunately, kids don't even have to get the chickenpox these days. You can get, a vaccine for that, but they still get the flu. So Ray's syndrome is a thing. Now, analgesic action. Aspirin inhibits synthetic prostaglandins. Prostaglandins are local acting hormones, and they're released when cell membranes are injured. Okay? So, therefore, they mediate pain in injured areas by sensitizing neurons to stimulation. Now, if you ever have an injury, if you put pressure near it but not on it, putting pressure near it helps the pain a little bit because the neurons around it are so sensitized. There's sort of this desensitization thing that goes on. So if you do touch around the injury, it can help, which is interesting. But aspirin inhibits the synthesis of these prostaglandins, right? So therefore, helping reduce pain. The antipyretic action, aspirin acts on prostaglandins involved in heat regulation. So there's that. Now, moving on from aspirin. Now we're going to talk about acetaminophen. Your typical acetaminophen that people think of is Tylenol. Compared to aspirin, acetaminophen is just as effective in analgesic and antipyretic effects. If you've forgotten what these words mean already, please go back and then come forward. Okay. Just as effective in analgesic and antipyretic effects, it's not very useful in anti-inflammatory issues. So if somebody has swelling, Tylenol is not helpful. If somebody has, inflammation, Tylenol is not helpful. Tylenol is helpful for those other things. Now, overuse can be a serious problem with Tylenol. Tylenol is great in appropriate doses, but if you are someone who already has liver issues, Tylenol is not for you. Drinking alcohol that is processed through your liver and using Tylenol is a bad idea. Too much Tylenol will cause your liver to shut down. Sometimes there's, teenagers or whoever who think about killing themselves, but they don't actually want to kill themselves, so they take a bunch of Tylenol thinking that it's safe, and they end up killing themselves, or they end up damaging their liver so much that they can never function the way that they used to. It's very upsetting. Also, Tylenol for many, many years has been given to infants in these concentrated drops. These were taken off the market a few years ago because they were so concentrated that it was easy for parents to give it to their children. And therefore, people were accidentally giving their children too much, overdosing children, and ending up in the emergency rooms. Hopefully, they ended up coming home from the emergency rooms. So, the concentrated drops for babies with Tylenol have been taken off the market, and you now, it's kind of a pain, but you have to give your child a larger dose to get the same amount of Tylenol to avoid possible overdose issues. So, Dawn data, acetaminophen has far surpassed aspirin for ER visits and deaths. FDA has limited the maximum single capsule amount to 650 milligrams for over-the-counter products. You rarely see things like that in a single capsule, but it's possible. Now, so there's that. There's Tylenol. Tylenol, when used as prescribed, is very helpful for are fever reducing, and are pain reducing. Acetaminophen. Okay, moving on to ibuprofen. So ibuprofen is an NSAID, or a non-steroidal anti-inflammatory drug. You may see that phrase, the NSAID, non-steroidal anti-inflammatory drug. It's effective as an analgesic as well as an anti-inflammatory. Okay, like aspirin, it inhibits those COX enzymes. Now, with ibuprofen, you really want to eat food with it, or it can cause nausea or stomach pain. It can cause liver damage if taken in large amounts. So it's not, like, the risk is not the same as with Tylenol, but it's still there. Okay. Ibuprofen is a very popular medication to be given when people have post-surgery inflammation, right? Because you wouldn't want to give aspirin, so you'd go with the, ibuprofen. Ibuprofen is going to be things like Advil. What else? Okay, moving on. Cold and allergy products. So colds are very common, as you know. They're viral infections. More than 100 different ones have been identified. Symptoms: coughing, sneezing, production of the fluid by mucous membranes. Virus transmission. So most cold viruses enter the body through the nose or eyes. So what happens is you, with your hands, touch a doorknob, touch a bathroom, something or other, touch something that other people have touched, and then you rub your eyes, or you pick your nose, or you touch your face, and eventually it gets in there. And that's often how it's transmitted. So, one, don't touch your face if you're out. Don't be OCD about this. This is just, kind of just general health things. Frequent hand washing is good. And by frequent, I mean after you go to the bathroom. When you come into the house after you've been outside with, a bunch of junk and people and germs. That kind of frequent. You don't want it to be so frequent that you're washing your hands constantly and you have worn the skin off of your hands. You don't want it to be where your hands are cracked and dry because you've washed them so way too much. Then you need to go see a therapist. Just saying. Okay. Frequent hand washing is great, and it doesn't have to be antibacterial soap. It can be, but it doesn't have to be. Soap is soap. Soap gets rid of the germs. Soap is very cool. Soap is super slippery. So what happens is you put the soap and water on your hands, and you put the soap, and then you rub your hands together because it gets the soap all over, and then soap is so slippery that when you put the water on your hands, the soap takes all the germs and slides them right off of your hands down the sink. Amazing. Okay. Go soap. Cold symptoms can be treated, but they're not technically cured. So modern cold remedies contain 3 ingredients. If you know these 3 ingredients, you can go and look at any cold medication and know what's in it. Antihistamines. Antihistamines are for temporary relief of runny nose and sneezing. They're also used for relief from allergy symptoms. Those are antihistamines. Runny nose, sneezing, things like that. Nasal decongestions. These are for temporary relief of swollen nasal membranes. And then we have our analgesic antipyretics in there. So you're going to have like a Tylenol or an ibuprofen or aspirin component for temporary relief of aches and pains and for fever reduction. These are our 3 most common types of ingredients. Some have some other things. Do your reading. Okay? So here's what it comes down to. I said before with the supplements, you need to be a critical thinker. You need to be a good consumer of products. You need to be a smart consumer of products. Now, same thing with over-the-counter products because you're choosing them yourself. These are FDA regulated, but you're still choosing them yourself. Remember this. Most products contain 1 or more of only these small number of ingredients, but in different combinations. So if you know the ingredients we talked about today, you should be able to go to a drugstore and just know everything, or know a lot. So with the things we talked about today, you really should be able to go in and understand a large proportion of the products. Often people do recommend single ingredient medications rather than these multi-ingredient cold medications, because you then get things for only the things you need. However, if you look at these multiple ingredient products and you actually have all the symptoms and you want something for all of them, go for it. But if you only have one of the symptoms, you don't need to be putting all that other stuff in your body. You can avoid medication interactions, side effects, avoid treating symptoms you don't have. So these are things to think about. This is all about, like I said, being an educated, informed, critical thinking consumer. Hooray! Okay, so I do want you to know things from today. I think it should be fairly easy to guess what's important because I said it. That's it. See you in the next chapter.